Good evening, doctor, and to everyone who's watching this session. Today we have with us Dr. Harjot Singh, and he is MBBS, MD Psychiatry, and he's had experience of in psychiatric field from last 15 years. He is in this field, and he got lots of award like Rashtriya Chakra Awards, best, and he's best consultant psychiatrist in Punjab. Welcome you, doctor. Thank you once again. And today he'll be going to discuss about the depression in children. Let's start with the conversation, doctor. My first question to you would be would you like to add something about the topic, doctor, before proceeding further?
Yeah, depression in the recent years has increased, Jyoti. That has increased quite a lot. In fact, it is one of the leading causes of morbidity these days, and one of the leading causes for the decrease in the life quotient of a person. Also, apart from this, it is one of the causes for absenteeism from work or from school. So it has to be taken seriously. More so, the recent adolescent suicides, which has increased, uh, and it's come to the notice of the media a lot. So those things have to be taken care of by the teamwork and also by the society at large. So 1 in 5 children, according to the recent WHO study, 1 in 5 children and adolescents uh, experience worldwide, mental health disorders, including depression. So that is the reason that it has become important to recognize depression at an early stage and treat it accordingly.
Thank you, doctor. Thank you so much. My first question is: what are the distinguished signs and symptoms of depression and anxiety in children, and how can parents and educators differentiate between the two, doctor?
See, in children, the depression manifests in somewhat different manner, but generally the criteria for depression remains the same according to DSM or the ICD-10 criteria. The important sign and symptom to see are persistent sadness, irritability, swings in mood, loss of interest in activities, changes in appetite or sleep patterns, difficulty in concentrating on paying attention, social withdrawal, physical symptoms in the form of, say, uh, headaches, stomach aches, decrease self-esteem or self-worth. And of course, children do not want to go to school. They are getting lesser grades in the recent times. So this change in behavior patterns should alert the adults about the ongoing depression in children.
What preventive measures can be implemented by the parents to avoid the development of depression and anxiety in children?
So initially, we have to focus on the causative factors first, and the various causative factors like genetics or environmental factors, like trauma, abuse, neglect, significant changes in life like moving from one place to another, social factors or school factors like bullying, social isolation, difficulties with peers, medical conditions like some chronic illness, pain or disability. These can all lead to the problems with children and behavior patterns, especially leading to depression. Now, once these are recognized, we should not be, many of the times the problem that I face in my clinical practice is that the parents are not ready to accept that their children has depression. Is the stigma attached to depressive disorders, to all the psychiatric disorders, I would say, is a lot, and that leads to hindrance in the treatment. And unrecognized or untreated depression can lead to many other problems like poor social performance, like increased amount of self harm, like suicidal thoughts and behaviors, long term mental health issues. So all that can happen if we do not treat it in the right manner. So the early recognition, there are scales. The parents should bring the children to the doctor. The scales and the psychological assessment should be done on time, and the treatment should be, given to children on time. Now, if you are suspecting that your child has, depressive disorder, you should be going to the doctor or the psychologist. You should be carrying out, you should be, worried about your child so much that you go and carry out all the required psychological assessments and testings. Unfortunately, in India, still a lot of stigma and labeling is there. Many of the problems that arise are because of the lack of knowledge and lack of understanding of these disorders. So
Okay.
if you consult, there are the likelihood is that in cases of children, the first person whom the first doctor whom the parents are going to visit is the pediatrician. So that should be a teamwork. The teamwork should involve a psychiatrist, a pediatrician, psychologist, social workers, and this team of the doctors can help the children in the best possible manner. Assessments can be done, counselings can be given, encouragement to children should be given to take part in activities other than academics, the extracurricular activities. Peer group modulation should be there. And the parents should be supportive enough of their children to guide them through the counselings, to keep up the adherence to the counseling. So that is, these things, they are very important for the mental well-being of their children.
Okay. What are some age appropriate methods to encourage children to express their emotions and communicate their feelings of depression or anxiety, doctor?
uh, First of all, the environment at home should be it should be conducive enough so that the children can express whatever they are feeling to their parents. Many a times, at least in the olden times, I have experienced that children were not allowed to express. They were told to follow the adults or whatever the orders were given to them, but their mental health suffered a lot during this time. So the first of all, the environment at home should be good. Second, school syllabus and the various curriculums, they now advocate the presence of a psychologist at school, so that if any person is feeling uncomfortable or is having anxiety or depression, that person can go to the psychologist and the school counselor for this purpose, and they can get it sorted out. If they are experiencing some uncomfortable environment at school, they can talk to the authorities and their teachers about it. So it is very important that they the children, they develop a sense of comfort, and they develop a sense of uh, security with the people around them. And this is one of the important factors in their mental well-being, in fact.
Okay. In what ways can parents and educator collaborate to create a holistic support system for children dealing with depression and anxiety, doctor?
So, like I said, the school curriculum now mandates that there is a school counselor in the school who can deal with and guide the parents about these problems. It is very important that during the parent teacher meeting, the meeting also involves the school counselor and the school educators, so that they understand the importance of mental well-being along with the academic performances. So in a way, it will be a collaborative effort. In fact, my team does try that we visit the school and guide the children about these disorders, and how these disorders can be taken care of, and how the children can be helped in overcoming at these problems at an initial stage.
Okay. How does incorporating hobbies and self-care practices such as gratitude play a role in effectively managing depression in children, doctor?
In fact, the all these things, meditation, exercise, yoga, mindful practicing, and planning pranayams, these are all helpful. And of course, going to religious places with parents, these all help in calming the mind. These days what I have seen is that children are having too much stress of their work. They have too much, there is too much competitiveness around them. If you do not excel, then this is going to happen, you're going to fail. So all these stresses, they lead to problems in their mental well-being. And practices like yoga, early morning walks, you know gratitude, and all these things, they give a sense of well-being. And if somebody is in anxiety and depression, even peer group modulation is very important in these cases, especially in case of adolescents where they become impulsive due to their hormonal changes. And in some cases they might do some kind of self harm, or they might start taking drugs or alcohol. So these kind of practices, they stabilize their personalities and help them calm their minds, and get them more towards a better moral support than going the other way around.
What are some evidence based in interventions and resources available for parents, educators, and children to navigate and manage depression and anxiety effectively, doctor?
See, in fact, there are many medications which are FDA approved medications for children. People were thinking till now that these are sleeping pills, but as of now, this is not the truth. And children can be helped with these things. Second, of course, like I said, meditation, mindfulness training, and training according to certain theories like attachment theory. Like there is a John Bowlby's theory about how attachment helps children, peer group modulation, getting counselings, and cognitive behavior therapies done. These things, they also help the parents, and also the children have calming effect on themselves. And once they have depression, the therapies like I said, medication, cognitive behavior therapy, they are all FDA approved for this purpose.
Thank you, doctor. Thank you so much. These are all the questions that I had for you. Would you like to convey any message from your side for the audience, doctor?
Yeah. So first of all, I would say people should understand that psychiatric disorders are similar to physical illnesses, and they can be treated in a similar manner. Stigmatizing these problems worsens the access to mental health, and that should be avoided at all costs. Better knowledge and better understanding of the disorders, of mental disorders, particularly in children, and understanding their treatment methodologies, which are FDA approved and they have been applied throughout the world with greater success, should be given to children. And children should not be denied of these FDA approved and WHO approved guidelines and medications, and other forms of treatment like counselings, cognitive behavior therapy. They should not be denied of these facts. And I would ask the parents to be open with their children about about their feelings, about understanding how the children are feeling, and about how they feel, and how, if they are bullied at school or they have had a traumatizing experience at school, they should come up and talk to their parents about it. Because if we create a good conducive environment, many of the problems will be solved only by talking and discussing it out with the children themselves.
Thank you, doctor. Thank you so much. It was very insightful session. Hope people will get the benefit from this. And thank you once again for joining us today. Thank you for your time. Thank you. Thank you so much.
Thank you, Jyoti. thank you for being such a good host to me.
Thank you,
It
sir.
was a nice experience talking to you.